Before training in frequency-specific microcurrent, FSM, I primarily viewed it as a tool used in musculoskeletal care. Through additional education and clinical experience, I've become more aware of the broader ways practitioners may incorporate FSM into patient care. In my own experience, after re-injuring a previous foot injury, I noticed significantly less swelling and bruising than I had experienced with similar injuries in the past after using FSM as part of my recovery approach. While everyone responds differently, this experience made me more curious about the potential role FSM may play in supporting recovery and symptom management. In clinical practice, we've also had patients report meaningful improvements in discomfort and function following FSM sessions for concerns involving tendon injury, knee injuries, meniscal injuries, ligament injuries, rotator cuff injuries, and groin strains. Some patients have described noticeable changes after a single treatment, while others experience more gradual improvement over time. What has been especially interesting to me is learning that some practitioners also explore FSM in contexts beyond musculoskeletal concerns. For example, a colleague who experiences arthritic pain and swelling in her hands has personally noticed improvement in her symptoms following treatment sessions. She has also shared that she notices fewer next-day symptoms after alcohol consumption when incorporating certain FSM protocols into her routine. This episode explores both the musculoskeletal and broader integrative applications of FSM while discussing importance of individualized care and the evolving nature of this area of practice. Welcome, Dr. McMakin. Thank you so much for joining us today for today's podcast on frequency-specific microcurrent. So I learned frequency-specific microcurrent from Dr. Carol McMakin, and she is a wealth of knowledge. So I'm so grateful that she can join us and share all of her wisdom with us today. So Dr. Carol McMakin, can you tell us how long you've been in practice and how long you've been utilizing frequency-specific microcurrent?
I started practice in 1994 as a chiropractor. I was a pharmaceutical salesman for 16 years. Went back to pre-med when I was 40. Started chiropractic college when I was 42. Graduated when I was 47 in 1994. In 1995, I got a list of frequencies from a chiropractor who was my teacher. He got this list of frequencies from an osteopath who bought a practice in 1946 that came with a machine that was built in 1922. And that machine came with a list of frequencies. And we started using them. Well, the first time I used them was to stop bleeding in somebody that I'd bruised with my thumbs. And then we started using them on muscle pain in 96, and we had such tremendous success that I decided I had to teach it to find out if it was reproducible. So that was 97, January. Been teaching it ever since. So now we started out with 10 people who bought this big analog blue box in 1997 from Doug Casey, who was the distributor at the time. And now we have 7,000 practitioners in 23 countries, a medical textbook published by Elsevier. We have The Resonance Effect, published by North Atlantic Books and Penguin Random House, and 23 published papers, actually 24, almost 25 if the next two get accepted. And I help muscle and nerve pain, thalamic pain, fibromyalgia, low back pain, neck pain, joint pain. We treat athletic injuries. I treated Terrell Owens so he could play in the Super Bowl. Treated Peyton Manning. Treated Bill Romanowski. Just football players in 2002 through about 2005 or 6. And now I have a little clinic in Troutdale in Oregon. So I've been in practice 30 years, I think. 32 years, actually. Been using FSM ever since. So it's an amazing tool. It's fun.
And to that point, we made a post on Instagram about your work with Terrell Owens, and he actually commented on the post because some people—
Did he really?
Because we had some people commenting saying, there's no way that this is real, this has to be fake, da 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 da. And so he actually was commenting back and confirming that the work you did
Yeah.
with him did make a
Yeah.
huge difference.
When he got accepted into the Hall of Fame, he introduced me and Brian and Buddy and Chelsea as the FSM Dream Team. It was pretty fun. He's a really nice guy. And most of the football players that I've treated have been really nice people. FSM has the ability to repair post-operative wounds and injuries. So I had a little surgery on a trigger finger a week ago, and the skin healed over the sutures, and I went to have sutures removed last night because I didn't want to wait till tomorrow when my appointment is a week out from the surgery. And they said it takes 10 days to fix those, and I said, look at my hand. The skin has grown over the sutures and there's no bruising. It didn't bruise. And it's like done 5 days out.
Pretty amazing stuff. So, I mean, for our listeners, frequency-specific microcurrent, as Dr. McMakin already mentioned, is amazing for sports injuries and for expediting healing. And that's what really led me to want to get trained with you and to learn this, because I myself had a lot of ligament injuries and issues. And that's what led me to want to educate myself on this topic and to use this as a tool in practice. But what blew my mind was all the other treatments that you could utilize for different applications. If you could share about the liver
Sure.
transplant.
Oh, well, we have a symposium every other year where practitioners come and do case reports. And I think it was 2017. One of the practitioners came, he's a chiropractor from Illinois, and he did a case report. We have a protocol on an automated unit that just runs through a sequence of frequencies. There's liver toxicity, there's liver virus, and there's liver fibrosis. And the chiropractor had a patient who, came in to get his back adjusted, and the patient said, well, I wish you could work on my liver the same way you can work on my back, because I've got hepatitis C and I'm on the list for a liver transplant. And Rick said, well, I've got this machine. I don't know if it would work, but it can't hurt you. So come in a couple of times a week. So the patient came in 3 times a week for 6 weeks and ran all 3 of those protocols, one after the other, 3 times a week for, I think, 4 or 6 weeks. And at the end of 6 weeks, his liver enzymes were normal. The hepatitis C seemed gone. I mean, it was just normal. So then the transplant team called him and said, well, we have your liver. And he said, well, you're going to have to give it to somebody else because I don't need it. And I think they called him 24 times between 4 o'clock in the afternoon and 4 o'clock in the morning, because liver matches are hard to come by. He was over it. Now, that's an N of 1. We don't know if it would work on everybody every time. In general, the data we have, all N of 1, it normalizes liver enzymes just by reducing inflammation in the liver, increasing liver function. It's leaky gut, irritable bowel, asthma, abdominal adhesions, ovarian cysts. Uterine fibroids are generally too big by the time we get around to them, so I don't have tremendous success with that. But ovarian cysts are easy. Vagus nerve, we actually have frequencies that had such good data that there's the company that got the research done has a patent that includes the frequencies for the vagus nerve. And we treat things that medicine doesn't have good luck with, which is part of why it's grown the way it has. Nerve pain is almost impossible to treat medically. Loss of descending inhibition, certain kinds of spasticity from strokes, that has turned out to be pretty straightforward. Trigeminal neuralgia, we have some good case reports on that. Can't put tissue back that's not there, so advanced Parkinson's, no. Advanced MS, no. But early stage or middle stage, we can at least slow progression. And the data we have on reducing inflammation in both animals and humans is just extraordinary. And we just stumbled across it. So this animal research lab in Australia did research on mice and found out that the frequency to reduce inflammation in the immune system reduced inflammation by 62% in every animal tested, when every prescription and non-prescription drug had never reduced inflammation by more than 45%. All of the inflammatory cytokines, we took 27 cases of fibromyalgia associated with spine trauma to NIH, and I got invited to do a grand rounds. And at the end of it, I said, okay, we've done this 27 times, and nobody is going to believe it. They come in with their pain at a 7.3 and they leave with their pain at a 1.3. Nobody's going to believe it unless we have data. And Terry Phillips came up and said, you get me a spot of blood on blotter paper and I'll get you the data. And what we found out is that we reduced inflammatory cytokines by factors of 10 and 20 times. Now, a cytokine is an inflammatory peptide. And what was interesting was that it reduced substance P, because FSM uses two frequencies at one time that cross in a field. You reduce inflammation in the spinal cord and the body pain goes down. Substance P is made in the spinal cord, and substance P went down by a factor of 10 times, 60 minutes. And the statistical significance of something is determined by something called a p-value. And if you can get a p-value of 0.01005, that's pretty good. Well, all of these cytokine measurements had 3 to 6 zeros at a 1 or a 2. So the statistics are pretty dramatic. And then the clinical results are just extraordinary. It's so fun. Somebody asked me, why should I learn FSM? And I said, my response is, because it's the most fun you're ever going to have in medicine. It's a blast.
I can definitely attest to that. But I essentially just tell my patients, like, we'll experiment, you know what I mean? We'll try. I'll put a protocol together. We'll see what happens. I'm like, if you're better, cool, we'll keep doing it. If you're not, then that wasn't the right protocol, because as you have said several times, the frequencies work if you have the right frequency. So if we put together the wrong protocol, it's not going to do anything, right? And so even yesterday, I had a patient who came in and she had some tendinosis in her supraspinatus. And so we just put together a quick protocol, and she was an 8 out of 10 when she came in, 0 out of 10 when she left, right? Like, it's like magic. That's what you feel. You feel like you're doing magic.
It's almost too hard to believe that it's real, right?
It is. That, like, I still, like, even though I do it, and I'm like, are you sure? Like, are you sure there's no pain now?
Can I just do that?
Yeah, it's fascinating. And then back to the organs and the tissues, another study that, again, blew my mind when I was training with you and you sharing all of your information with the cysts in the breast, or the density of the breasts.
It was a paper that one of our practitioners published, I think, 24, 25. The patient had fibrocystic breasts, and the practitioner found that the frequency for calcium oxalate is what softened the tissues. So I think she treated her 6 times or so, maybe 8, over a period of about 3 or 4 months. And then they redid the mammogram. And so they had documented that the breast density, the fibrosis, went down by about 50%. And so the practitioner submitted it for publication. And I've published 12 papers at this point, and I don't think I've ever read a review like reviewers read papers and they look for things to pick apart. And the reviewer was just over the top with excitement, because the short version was, do you realize that this patient went from a type 3 to a type 2, or just basically down a step, but you've reduced her risk of breast cancer by 50%. I mean, I've treated patients with fibrocystic breasts. There's a protocol. One of our OBGYNs developed a protocol for increasing secretions in the mammary gland when a woman has trouble making enough milk to feed her baby. And just is hilarious because now all of a sudden she's just a gusher.
Oh my God,
And
I know that.
there's a frequency. The only thing it's good for is kidney stone pain. Doesn't do anything for the stone, just the pain. Then the dissolve the stone is a different set. And one of the practitioners, his wife had a 1 centimeter stone and two sevens, 7 millimeter stones. And she wouldn't let them do lithotripsy because it beat her up so bad the year before. And so she opted for surgery. Well, it took a week for them to get space in the operating room. So the morning of the surgery, she said, I'm not going to let you do surgery until we redo the CT scan. And they said, look, it's a 1 centimeter and two sevens. They're not going to be gone. And she said, that's okay. I'm not going to sign the consent until you redo the CT scan. So they did the CT scan. The two 7 millimeter stones were gone, like not there. And the 10 millimeter stone, or the 1 centimeter stone, was down to a 7. So they canceled the surgery.
Wow.
And meanwhile, as you're passing the stone, there's a frequency that can help keep you out of pain. It's just crazy. It's so much fun.
It's just it's endless. I feel like the world's your oyster when it comes to frequencies. The more you learn, the more you just go down a rabbit hole and you're like, "Oh, what about this and this?" And I know one of the presenters in your course talked about support even for the cardiovascular system, and I was like, "Whoa." You know how sometimes like things kind of you're like, "I don't know, that makes me nervous." But it was just fascinating because you're like, "Okay, literally anything's possible."
It's worth a try. I mean, the current is the same kind of current that your body produces on its own. The precautions are really well spelled out. We don't treat deep vein thrombosis. We don't treat blood clots in veins because there's no guarantee. I mean, we have photographs of taking apart blood clots, superficial ones. So you've got a bruise and you run the frequency to dissolve the blood clot, and this purple bruise turns bright red and spreads out, and then you run the frequency to stop bleeding and it turns purple again, and you just play with it, and it's like, okay, so you can't treat a deep vein thrombus, but one of our physical therapists had a patient with full thickness deep vein thrombosis in both of the deep veins in her calf. And so she treated the patient for vitality in the vein and torn and broken in the vein, like something was just wrong with the vein. The next day, the ultrasound showed the clot was gone, and the D-dimer, the blood work, was 0. It was gone. And as long as you follow the rules, you don't take people that are pregnant, you don't treat cancer, but you can help with radiation burns and radiation scarring and the nausea from chemotherapy. And you don't take apart blood clots, but if you treat vitality in the veins, apparently blood clots can go away. Who knew?
Phenomenal.
Yeah, it's pretty fun.
Very fun. Very fun. Okay, so we talked about the liver, the breast, kidney stones. We talked about cysts, ovarian cysts. You said they're very easy to treat too. I haven't treated yet, but I have the protocol ready to go
Yeah,
for a
just in
patient.
case.
Yeah, ready to go. Is there anything else that comes to mind that fascinates?
Surprising.
Yes.
Asthma is fairly straightforward, both acute and chronic. It's not a one visit fix. You have to figure out why they have asthma, treat the fibrosis or scarring from chronic asthma, and that's fairly straightforward. Shoulder, I mean, musculoskeletal wise, treating partial thickness tears in the meniscus and in the tendons in the shoulder. Elbow pain is hardly ever from the elbow. It's usually from one of the nerves coming from the neck. Treating neck pain, disc bulges. And the nice thing is that if it doesn't work, you know that it's a good time to do an MRI and see if the patient's surgical. Fully 50% of the class, as you know, is diagnostic. It's differential diagnosis. You have to treat the right thing with the right thing. It is really good for inquisitive minds that want to learn and want to help people.
And before we wrap up, can you share a little bit about your next in-person training for those who are interested in learning from you?
If you go to frequencyspecific.com, the whole schedule is there. The next one is on May 17th. We have a practicum, so if you take it on video, you can take the coursework at your own pace. The 5-day is intense. It's a lot of material. If you take it on video, that way you get the course content, but you don't really believe that the frequencies are doing what I say they're going to do until you feel it with your hands. So that's where the practicums come in. So we'll have a 5-day core, and then the next month we'll have a 2-day practicum, and then a 5-day core, and then a 2-day practicum. This year we'll be in London in November, Costa Rica in October, and Poland in September. So we do usually 3 foreign courses, and anytime we're in the US, we'll do a core about once every other month, and then practicums on the weekends. Also, for non-practitioners, there's a fair amount of information about FSM and how to use it and why to use it and all the good stuff.
Okay, amazing. So we'll put everything in the show notes too, so people know where to find you, and if they're interested in training, that they can sign up online.
Thank you very much. I appreciate it.
Thank you so much for your time, Dr. McMakin. I appreciate it. Have a wonderful day and enjoy your next podcast.
Thank you, Jennifer. Take care. Bye.
Bye-bye.